That jump in daily cases is the kind of thing that worries hospital officials, especially when it corresponds to an increase in patients, specifically in the ICU. More on that tonight from WBZ's Paul Burton.
As the number of coronavirus cases continue to rise, ICUs and hospitals across the state are feeling the burden.
ICUs are extremely busy.
Dr. Nicholas Smyrnius is a medical director for patient safety at UMass Memorial Hospital in Worcester. To prepare for the surge, he says his team had to create a new ICU space.
We took our 2 medical intensive care units and we moved them to a different part, swapped them with other ICUs. So that the COVID patients can be in the rooms with the correct ventilation.
Our hospital capacity limits are being stretched to their limit.
This is probably the most difficult thing I've ever done.
Staff nurses Sandy Keenan and Lulu Floyd at Tufts Medical Center ICU says the surge is real. They also had to open additional ICU spaces.
These patients are incredibly ill. They require an incredible amount of care. It's very similar to the last surge.
Aside from the limited amount of space that hospitals are facing, another big concern is the limitation on personnel. Doctors say there's simply not enough help to deal with the surge and the amount of care that is needed.
Our ability to take care of people is limited by the number of respiratory therapists we have, the number of nurses we have.
We basically need double the amount of staff now. So we normally used to run with like 6, depending on the day, 6 to 8 nurses. Now we have staffed between the 2 units about 13 or 14 basically.
To help alleviate some of the strain, the state has opened up 2 COVID-19 field hospitals. One is at the DCU Center in Worcester. The second is located at the Recreation Center at UMass Lowell in Lowell. In Boston, I'm Paul Burton, WBZ News.